Well, hi there. I'm Diana Montford, the world's first transgender television journalist. I get so tired of telling everybody this, but I have to make it clear on every show because otherwise people say, huh? Anyway, first transgender television journalist on Earth, first TV. Born male, became female. And my wonderful guests are our wonderful friend, trans woman Tanya Walker, who's going to talk about this wonderful transgender health facility at Choices in Jamaica, Queens, and the wonderful, what are you, the director?
Of counseling.
Of counseling at Choices, Miss Esther Priegue, who's going to tell us all about, Choices and how we can get there. It's this wonderful place started by Ms. Merle Hoffman.
Mm-hmm.
It was started in 1971. Even I was young then. And because she wanted to create an abortion clinic for those who needed an abortion clinic and, all sorts of birth control and everything. And sadly, things have gone back to the way they were in 1971 because it's very difficult to access an abortion in many states now, even to access birth control. And if you're a trans woman, obviously abortion and birth control aren't your main concerns, but just accessing hormone therapy and respectful medical care is difficult. So we're going to talk with Esther and Tanya about this wonderful clinic that they have. And it's not for rich people, and it's not for rich white people. And if you don't have any money and you're a person of color, that's just great. They like you even better. So that's not true. Everyone is welcome, of all shades and genders and socioeconomic backgrounds. But if you have no money at all, go to Choices because they're really cool,
Very true. Choices has been around for 45 years or more at this time. Choices actually got started because Merle Hoffman saw a need. She saw a need in the community for women to have a choice regarding reproductive health care. And one of the things that she wanted to do is provide a safe place that women could come to, a place where they could even decide their choice.
Yes.
And provide them quality health care.
You don't have to have an abortion. You can put your baby up for adoption, or you can have the baby and hopefully get assistance from the government. And Tanya is going to tell us all about this wonderful transgender group that she has started at Choices. So tell us.
Hi, I'm Tanya Azapanza Johnson Walker, and I am the outreach coordinator or transgender outreach coordinator at Choices Women's Medical for Choices Trans Care in Jamaica, Queens. Basically, what I do is I outreach to different organizations that have trans people and gender nonconforming people, and I let them know that we are launching Choices Trans Care, and the launch date is for September 29th.
And this show may air after that. We are shooting this on September 1st. But after September 29th, 2016, the transgender clinic at Choices in Jamaica, Queens will be open and certainly there to help you.
I was fortunate enough to be chosen as the transgender outreach coordinator. And usually what I do when I go out in the field, I take one of these little packets with me, and it has the Choices address and the phone number on there in Jamaica, Queens. And inside it has cards. I put cards in there. One card talks about that we're launching the Choices Trans Care Clinic, and the other card is my card to call me for any questions or anything that's needed. It also contains an email address, which is transcare@choicesmedical.com. Transcare@choicesmedical.com. So if you have any questions, it's something you need to know, what we offer, what we don't offer, just let me know. We're on Facebook and Instagram. We're on Instagram as Choices Transcare Medical, and we're also on Facebook, Choices Transcare on Facebook. So just look us up, and you can find us. Basically, and even in this day and age in 2016, it's hard for a trans person to access decent, safe health care. and we live in one of the largest cities in the world.
That's right.
And you would think that everyone's on board in the medical field about caring for trans folk and gender nonconforming, and that's not so. There's a lot of cultural incompetence out there, and there's a lot of willfulness where people do just sit on their hands. They don't want to become culturally competent, and I'm here to teach them to be culturally competent, and myself and Esther Priegue and Choices Women's Medical. I'm grateful to Merle Hoffman for choosing me to come out and do this work, and I'm very proud. And it's rewarding because Choices Trans Care will help people with their hormones. They'll also have HIV testing. They'll have gynecological care for trans people who may need that, and they'll also see people who are post-ops at Choices Trans Care. So we're looking forward to opening this program. In the future, we'll probably have groups, so they will be following the WPATH standards of care, which will give you the best health care on planet Earth. And
whether or not you can afford it, they will give you instant Medicaid if you need it.
Yes, they will sign you up for Medicaid. And Choices is 147-32, Jamaica Avenue, Jamaica, New York. So you could come in for trans care, because we're going to open on the 29th of September 2016.
Now, that may have come and gone by the time you see this show, but certainly access this medical care. Whether you're a cisgender woman who has gynecological concerns or a transgender woman, they are really good people, and they will really help you. Really help you. Now, you said that you were going to start groups. Do you mean discussion groups?
Like a health group where the social worker will come in or the nurse will come in, and if there's any problems, or if we need to change something, or we're not doing something right, we can let them know.
But I mean,
and we
you
can
will
do it
also
right.
have like a peer group,
Right. So
discussion group.
This will be optimal health care for trans
aside
and gender
from health care,
non-conforming people.
psychological care.
And
correct.
psychological care
That's one of
also.
the needs that came to us when we went also to a focus group in Jackson Heights in January, was that there was social emotional needs, and not just a social group, but also a group of support.
Absolutely.
A group where you could have for allies, friends, your loved ones who need to understand your process in time, and to get support too. And this is a place where you could do that.
Many years ago, I went to the Transgender Project at the center here in Manhattan. Many years ago, circa 1999, and although I'd been trans for a long, long time, it gave me great confidence to understand that all other trans women go through a lot of the same things that I go through, and that we're all more alike than we are different. And that gives you great strength in life, I've
Correct.
found.
Yes.
Yeah.
Correct.
And I and others are helping to train the staff to be
right.
culturally competent at Choices Women's Medical to receive trans and gender nonconforming trans men and trans women, both post-op and pre-op, and you will receive hormone therapy and basic health care.
Yes, and if you are a trans man, you might be more comfortable in a men's facility, and they will steer you to a men's facility, because of course
Correct.
if it's a women's health space, so a trans man, depends on how long.
Post-op or pre-op.
Right, yeah.
We'll
Right.
take pre-ops.
That's correct.
We'll take pre-op.
Well, no, that's
Trans
a
men.
slippery slope. What's a
Correct.
pre-op trans? I mean,
Correct. Correct.
it's very difficult to say this one's pre-op, this one's post-op.
Right.
So,
Some people just say.
So then if that's the case, you will reach out to us. We'll have the doctors review your medical records and see if we can provide you that quality of health care that you deserve and need.
yes, and if they can't, they will steer you to somewhere where you can get it.
Correct. And, when discussing this piece of the educational piece, and also getting to have health groups to discuss things, to be able to actually have wellness of care, because that's what we're looking to do also, is to provide
Yes,
a
yes.
safe environment where we could talk about wellness of care. We want to be able to provide mental health services where people will need to speak to a social worker or a psychologist to talk about what's going on in their process at this time. We know depression could be an issue, right?
Yes.
Especially throughout these challenging of times. Issues with your partner. There could be issues of domestic violence. There could be issues in regards to your family rejecting you at some point or another.
Well, and it's all a kind of domino thing. You have no money, so you go live with someone, and then that someone beats you up.
Right.
And then you're depressed.
Right.
And then, I mean, so,
Right.
Well, there's a lot of depression in the trans and gender
I
nonconforming
wonder
community
why.
because
Could
there's
it be because everybody hates us, maybe?
there's the healthcare. There's a lot of culturally incompetent health providers who are not providing services geared towards trans folk. Trans people have the highest unemployment rate. They have the highest suits. They have the highest unemployment rate. The highest rate of people who are not educated, who don't have college degrees.
Well, that's because they're bullied at school, and often they drop out early in school because they are sometimes in physical fear for their lives.
Right.
So, I mean,
Trans people are people. Trans people want to be self-actualized in society. They like in Abraham Maslow's hierarchy of needs. Trans people they're just like anybody else. Get to know a trans person, sit with a trans person, eat with a trans person. That you may have the same ideas.
Yeah, I mean, trans people are people first.
That's
It's
right.
just a little blip on the screen, and everyone makes such a big deal out of it.
Yeah.
You're trans. I do not have
Yeah.
a lavender Q stamped
Yeah.
on my chest for
Exactly.
that.
Right, you're trans.
Exactly. When we started this process back in January, Moral Health and Access to go out into the community, find out what the needs are. Find out what is it that they need and get to know the community. And we started with people such as Melissa Sklarz, who actually introduced us to Tanya Walker.
Yes.
And that's how the process started in getting to know the community.
And you've seen Melissa here many a time, and I've known her
right.
since
Yes.
the dawn of time, and she introduced me to Tanya.
Yes.
And Tanya introduced me to you.
Yes.
And
right.
hopefully you'll introduce me to Merle, and we'll all know one
Definitely.
another and work to make it better.
Most definitely. And one of the things that when you come into Choices, what we wanted to do is provide you a type of service where you feel comfortable, safe. It's a beautiful environment, Choices. I welcome anyone to come see our site. When you walk into the door, you'll be assigned a number, so there's an anonymity to who you are to give you confidentiality, just like any other patient at Choices. And you get to pulsively watch and speak to someone in finance. If you have issues with insurance, they'll help you there. You'll come to our counseling department after that, and you'll meet with us, and we'll sit down and go with you, do an assessment, discuss what your needs are, and then hopefully if you need a letter to help you towards your transition process, well, then that's what we're going to be able to do at that moment.
If someone is living in a shelter and all that, or
Yes.
has no fixed address, doesn't matter. You'll help them anyway.
Right. As a matter of fact, Choices Women's Medical Center has been working with the Care for the Homeless for a couple of months now, where we've been starting a process where we will even have women at the shelters come to our site. If we have to bus them or have an actual car service pick them up, we will. So this way there is no barriers. There is no excuses. You need to come and get your quality OBGYN health care. That's what we're here for, to provide that for you.
Absolutely. So Tanya,
Yes.
how did you connect with Choices?
Through Melissa Sklarz.
Yes.
Through Melissa Sklarz. She called me up and she said that they needed someone out there to outreach to the community because they're getting ready to open a transgender program. So I said, great, this is a great opportunity for me to return to employment as a black trans woman, because as we may know or may not know, black trans women they have the highest rate of unemployment anywhere, and homelessness, HIV.
Often because trans women, the only venue open to them to earn a living is sex work,
Right.
and they contract HIV that way.
Right.
And in Jamaica, Queens, there's really nothing out there
Excuse
for the trans community
That's right.
that's serving the trans community medically or for mental health. And Choices Trans Care, this program will be a great program, and it will help take care of the needs of the community, the trans community, especially out there.
Well, I know
and the
there's a
cis
lot
women's
of trans
community.
people in Jamaica, so I mean, it's
Yeah.
surprising that there is no.
Correct.
Yeah.
So that's how we started the discussion, because if a patient comes to Choices, that's great where they're in the neighborhood, but if actually till now, really they've been either going out to Manhattan
Yeah.
or the parts and not getting services nearby. So
And imagine if you're like feeling really bad and you're sick.
Right.
Now you have to get on the train and go into Manhattan and then get from the train station
That's
to wherever
right.
you're going. And then they say, oh, I'm sorry, you have no medical insurance. I'm so sorry.
Right.
Goodbye. You know, I mean, no.
yeah. And Choices is located in a spot where you have the air train, you have all the main buses, you have the E and the F train. It's a location where it's central to both
Absolutely.
Queens, get to Manhattan very shortly. You could also be in Nassau County,
You take the
Suffolk
7,
County.
right?
You could take actually the E and the F line directly and the J line straight to Choices
Okay.
to Suffolk Boulevard. So we're close, and we see patients from all over because we have the air train next to us also. So there's people who come straight from the airport and receive services for Choices Women's OBGYN care. People,
And we should talk about that now.
yes.
Tanya, you take people from everywhere.
Yes.
It doesn't, you don't have to live in New York. You can live in Texas, you can live in North Carolina. You can live and hold that pee-pee, wherever you live in North Carolina. You can live wherever you live. And will you help people to get to New York?
Yes, we will. Yes, Choices has a program. Choices Women's Medical has a program, yes, that will help people get to New York. Basically, Choices Trans Care is going to be excellent for the community. I mean, they're committed to empowering the transgender community
Well, let me ask you something
and
now.
equality. They're also for equality.
All right, let's say I live in Baltimore, and
Right.
I'm sure they have their own facilities, but let's say they don't, but I know they do. But let's say you want to go to New York to go to your place, Choices, the trans care. They have no money. Like, can't get a bus ticket, can't get anything, have no money at all.
Right.
Will you send them
Right.
some money or a ticket or something?
I think that we will try to do is we will try to organize the resources that exist from Baltimore to New York to get them to come here. And if they need a place to stay, then we'll then reconnect with resources that do exist in the community to help them, and then they get started. Our role, even with Care for the Homeless, has been to be able to create services that actually sync. Because what happens that many of the residents in those shelter systems get lost.
Yeah.
So this would be a quick way actually for us to all work together and establish all the services in the neighborhood and feel safe coming to those sites.
Well, that's because many trans women in shelters
yes.
do not feel safe. Even the guards harass them. Even the guards who live in other shelters,
That's right.
who work at a different shelter, harass trans women.
Yeah.
So respect in a safe place
Yes.
is
Very
very
important.
important.
Yes, and so there's a lot of shelters in Queens, and so I'm outreaching currently to some of the women shelters
Yes.
out in Jamaica, Queens, and in the Queens area because I know there are trans women in those shelters, and who need health care, and Choices Trans Care should be the place for them to
Yes.
come, to access health care, to access hormones, to get counseling, to to take care of all of their health needs. They also do referrals for people who want to go out and find a doctor for SRS, for or GRS, gender reassignment surgery.
I think now they call it gender confirmation surgery. Every minute it changes.
Yes.
It's changing. and
Or
evolving.
gender affirming surgery,
Yeah,
whatever
that's
you
whatever.
call it. Choices will do referrals to doctors who are doing it correctly. They're not going to send you to somebody just practicing. They're going to send you to people who are going to give you the best surgery on planet Earth.
Yes.
This is a great
Hopefully
program.
at reasonable prices.
Great program. Yes.
Because, I mean, it's one thing if you have a ton of money and you can say, do me. But if
Right.
you don't, it's,
Right.
you know.
And also it's just connect. I mean, since we know there's limited resources in the transgender community as well regarding, having even access to either a phone or even to have a Wi-Fi. So
Exactly.
this would be a place you could come in and we could speak to you and
And
give you
then-
those resources.
And if you're, okay, now let's say I have no money, I come in off the street, I have no fixed address. I have no place to recover in. Do you then put that person in some kind of bed, some...
So we will then need to connect, and that's when we need to connect with the community to be able to find a place to go that day.
And will you be able to?
I believe yes. I mean, if I've done it with cis women, I mean, where we have to assist them and trying to get to a domestic violence shelter
Right.
overnight, I don't see why we wouldn't do anything different for a transgender.
That's wonderful.
And
it
they
shouldn't
do
be no
walk-ins.
different. Yes, and that's very important also at Choices. We actually been very lucky that we could actually do everything all in one day. Let's put it that way. You could walk into Choices without an appointment. You could actually get your health insurance established. You could actually get all your lab work, get your sonos done, get counseling, and see a provider all in one day.
Which is wonderful, because if you don't have a fixed address and you just scraping together a subway fare to get there is
Right.
really tough.
Right.
You don't want to be told, come back 2 weeks from now.
Correct.
Yes.
Correct. And also, we believe in wellness care, and if this is the moment you took the time to finally take care of yourself, which is important, and if that is the only time, we need to make sure that we actually do this now.
Yeah, because some people are lucky enough to have paid employment and can't really,
Right.
go
Right.
wherever.
They can, and and also the time.
Sure.
They took this time. They may have other obligations, and this is the only moment they have. So we're here to help them at that moment.
This is so wonderful, because when I transitioned, there were doctors I had to pay,
That's right.
and that was very nice. And through the grace of God, I could afford it. But I mean, well, Brooklyn Hospital, they were doing great stuff there.
Yes.
Yeah. And but aside from that, there weren't a lot of places you could go, and it's great that this is happening now. I mean, that transgender people are getting finally some measure of respect and excellent medical care.
Right, and that's what it should be.
Yes.
Right, and that's what we want to be able to establish. I don't want to hear from another organization that they're not ready.
Which you have heard.
Yes, I have heard as we started to do outreach in the community to find out where can I send my transgender patients to if they need further services. And I said, it's time to get ready. It really is time.
Many years ago, Francesco Scavullo, the photographer, I asked him, well, I'd sort of like to model. And he said, well, you could, but the problem is the fashion magazines aren't ready for you. Now there are trans models all over the place.
Yes.
That's
But
true.
it's 40 years later, but there are trans models
That's
all
right.
over the place. Yeah.
That's right. That's right. And hopefully by having the trans community come to our site, they could feel comfortable and see that we are actually a community. We all want to be able to help. We've worked really hard in the last couple of months with Tanya and the trans community coming in to meet our staff.
What are you doing on your phone, Tanya?
I'm
They can
trying-
see you looking down and they wonder what the hell you're
I'm
doing.
trying. I'm looking because we have we're still getting our social media in order, and we're still working on it. So I'm making sure I'm going on social media because Choices Trans Care is our Instagram, and Choices
No.
Medical Trans Care is our Facebook,
That's
and I
right.
want to get that across.
Yes.
I want to get that point across. So I'm really and I'm also working with the social media, with the Instagram and the Facebook page.
And it's good that
For
you
now,
made these
temporarily.
hospitals ready, because somebody has to do it.
Well, yes, and I mean, Health and Hospitals Corporation did start the process, and there is one in each borough.
Let me ask you a question. You're a heterosexual cisgender woman with a husband and a baby. Why should you care about us?
Why not? Bottom line is, if you're in need, that's exactly what Hoffman has always said. Here's a group of women who always needed something at a point in time, and now here's another group that needs help. Why not? Either way, we're human beings, and why would we not help the transgender community? It's actually about time
Yes,
that we are included in that mix, right?
Yes.
Because we are a family together. We want to be able to help
Yes.
each other.
Yes, we are. And that's something so many people don't understand. And now you have a very nice job at this place, and you're
Yes.
getting a very nice salary. You
Yes.
are, aren't you?
Yes. Yes.
Well, nice enough.
Yes, they treat me fabulous there. The staff is being trained very well
Yeah.
to
Do you have
receive the
employment
trans community.
opportunities for other trans people here?
In the future, there will be more opportunities for employment at Choices for trans people. Yes, there will be, and I will help Choices Women's Medical create those positions. Yes, because there's a need in the community, a huge need for jobs and employment. That's what's bringing on a lot of the depression and a lot of the different health issues,
Yeah.
suicidal ideation, and different things, because people don't see trans people as people, especially trans women. Trans women can't even go to the bathroom to pee because anything a trans woman tries to do, even politicians, they're making laws all around the country, 100 new laws against trans women. When you become a trans woman, it's to the patriarchal
Yeah.
root in
You're
society.
affronting these men who say, how could you be less than a man? When
Yeah.
you were born a man. Fool,
Right.
you're throwing it away. Don't you dare ever even think of killing yourself.
That's right.
Call Choices. Call me. Call anyone.
We have a hotline.
We are here
We'll
for
have a
you.
hotline.
Do not even think of that.
Right.
We can save you.
Most definitely.
Whatever's going on, we can save you.
Definitely. And as actually the mental health issues are being actually discussed at Choices, we will be there to follow you, assess you, and if we feel the need that you need further, we'll be able to provide that service
How
as
can
well.
people contact Choices?
You can reach us in many different ways. First, you're by phone, 718-786-5000 is our main number, but you could text us. You could actually email us. You can make an appointment online.
How?
At choiceswomenmedical.com.
Okay.
And also,
And for I'm the transgender outreach coordinator, and at TransCare, we're TransCare at choicesmedical.com. That's the email. And if you want to reach me, you just dial 718-349-9100, extension 165.
Okay, and we're here for you. You don't have to be alone. You don't have to be afraid. Whatever's going on where you live, come to us. We'll take care of you. If
Your life matters. Trans
Yes.
lives matter.
Most
And
definitely.
women's lives matter.
of all colors, of all
Cis women's
shapes
lives
and all
also.
sizes, yes.
everybody, of all ages.
Trans
if you're
and
not
cis
22 and gorgeous, that's just fine with us. So if you're like 95 and not so gorgeous, come anyway.
Right.
Yes.
Anyway, I'm Diana Montford. This has been the Diana Montford Show. My guests have been Ms. Tanya Walker, trans woman and coordinator of the transgender clinic at Choices, and Miss Esther Priegue, who is the
Director of Counseling at Choices Women's Medical Center.
right. And make sure you call them wherever you are watching this, because they can help. I'm Diana Montford. This has been the Diana Montford Show. You know I love you, and I want you to be okay and happy and at peace and happy. So even if nobody else loves you, I love you. You take real good care of yourself, and I'll see you soon. And just know that Choices is here for you. What's that number again? Oh, well, we're out of time.